So thank you organizers for the opportunity, and this would be the interim analysis from the GALAXIES Lung-201 trial. So this is a basically phase 2 randomized open label study combining the Belrestotug plus Dostarlimab in the patient with PD-L1 high, that is TPS 50% or more in advanced metastatic NSCLC. Normally what we see is that whenever we see more than 50% PD-L1 expression, we think that that is a good opportunity to offer some immunotherapy drugs, and we expect the good result. But when we see it carefully from the trial, Keynote 024 trial, the response rate was close to 45%, and even the overall survival, 5-year survival, was 26%. So this study tried to analyze whether there can be, the results can be improved beyond this. So currently the first line treatment option for this particular subset of patient, that is PD-L1 50% or more, one of the treatment option includes single agent pembrolizumab, but the response rates are usually less than 50%, which necessitates the new treatment approaches. The Dostarlimab, as we are already aware, that it has shown a comparable clinical activity with the pembrolizumab in first line NSCLC in the PERLA trial, which was a phase 2 study, and it was combined with the chemotherapy as versus the standard of care, that is pembro and chemotherapy. As we were trying to see for the mechanism of resistance to overcome the resistance, so this was another, this anti-PD-L1 were combined with a novel anti-TIGIT inhibitory immune checkpoint inhibitor like Belrestotug. Normally this Belrestotug, it is an FCY receptor enabled monoclonal antibody. It modulates the CD226 pathways. It will inhibit the regulatory T cell proliferation, and ultimately it is also having a higher potency for as compared to other anti-TIGIT monoclonal antibodies. Apart from that, because of this unique mechanism, it will increase the CD8 T cell expression, while it will reduce the regulatory T cell in the patients. So this was a study design. Known patient, untreated, unresectable, locally advanced metastatic NSCLC, PD-L1 score high either by the DACO or the Ventana SP263 assay, no actionable mutation, and current or the former smokers were included. Asymptomatic, even the treated brain metastasis were eligible. Basically for this study, we can see the sub-study 1 for this, particularly for this session, where the pembrolizumab was compared with the Dostarlimab along with the combination of Belrestotug. These various different doses of the Belrestotug were used, like 100 milligram, 400 and 1000 milligram. The primary endpoint for this study was overall response rate, while the secondary endpoints are PFS, OS, duration of the response, safety, and the other parameters. For this particular study, total data of cutoff, so total 124 patients were eligible, and the median follow-up of 7.3 months. When we see the baseline demographic characteristic, majority of the patient were male. Even the Asian people were there included, mostly from 16 to 30%, while most of the patient had an excellent performance status. We can see the central, this PD-L1 central testing was available for those patients having PD-L1 TPS score of 90% or more, and even in 38 to 40% of the patients. So this was a primary efficacy endpoint of overall response rate. We can see that after a median follow-up, the overall response rate with Dostarlimab was 37%, while with 100 milligram Belrestotug with Dostarlimab, it was 63%, 65% with a higher dose of 400 milligram Belrestotug, while it was 76% with the 1000 milligram of Belrestotug. We can see majority of the patient had a partial response or a stable disease, and even the confirmed overall response rates were also seen. So this was showing the combination also showed a greater reduction in the tumor size, as we can see from the waterfall charts, and even the depth of the responses was higher as compared to the combination treatment versus the Dostarlimab monotherapy. So as we see the ctDNA as an biomarker for the molecular testings and the molecular responses, from this study also when they evaluated the ctDNA reduction in the ctDNA after the treatment, with the median reduction was 65% with the Dostarlimab alone, while it was 100 mg Belrestotug with Dostarlimab, it was 55% versus 94% with the 400 milligram Belrestotug, while it was 97% reduction in the ctDNA in the 1000 milligram Belrestotug arm. So when coming toward the safety profile, this combination has shown that there might be increase in the immune related adverse event. As we can see, almost treatment emergent adverse event in almost 90 to 97% of the patient. But when we see the majority grade 3 or more adverse event, they were seen in 60%, 16% versus 33% in 100 milligram, while 22% and morely with the 1000 milligram arm. While grade 4 serious adverse event were uncommon, like 7% and 3% only. While the rates of the treatment discontinuation because of the adverse event, 6% with the Dostarlimab, while 23% in the 100 milligram, 16% in the 400 arm, and the 40% in the 1000 milligram arm. Even similarly, the other adverse event. So most common treatment related adverse event were skin and the subcutaneous tissue disorder, and as we are aware that endocrine disorder like hypothyroidism were seen, and even the treatment discontinuation reasons were skin and again subcutaneous disorders and other thoracic and mediastinal disorder. While rarely the fatal event were seen like immune mediated hepatitis, pneumonitis and the myocarditis. And this was again we can see the treatment related adverse event, most commonly either the skin, subcutaneous tissue or maybe the hypothyroidism were seen. So to conclude, the GALAXIES Lung-201 is the largest presented randomized phase 2 study in the patient who have been previously untreated, unresectable, locally advanced metastatic NSCLC with high PD-L1 expression, where they have assessed anti-TIGIT with anti-PD-1 combination. So Belrestotug is a differentiated anti-TIGIT monoclonal antibody with multiple mechanism of action. Clinically meaningful improvement in overall response rate was observed in all combination cohorts compared with the Dostarlimab monotherapy, and the combination regimen had an increase in the immune related adverse event which but generally manageable. So this trial will ongoing recruitment in the reported arms and additional follow-up with better characteristics for the long-term safety and efficacy will be needed. Follow-up of this study will inform the future development of the Belrestotug. Thank you.